We're taking you inside a local COVID ward for an exclusive behind-the-scenes look at the life and death fight happening there.
And while our hospitals certainly haven't been overwhelmed with patients like many other states or even countries, our doctors and nurses do continue to battle this virus every single day. Our Wayne Haverly actually has been digging deeper to get this exclusive access. Wayne joins us live in studio now with what he was able to discover, Wayne.
Yeah, the Portland VA hospital allowed photographer Bill Cortez and I to spend a day inside its specially designed COVID ward. From patients recovering in negative pressure rooms to the doctors, nurses, and support workers, we thank them for allowing us to give you this revealing look at the actual front line of this pandemic.
How did you feel when you got here?
Like a pile of shit. I mean, like I felt really bad.
Behind these tightly sealed doors at the Portland VA hospital, doctors, nurses, and support staff have been in full battle mode ever since the first COVID patient arrived back in March.
Watching people die alone, as we have for the last 10 months, I think has changed all of us. I think that's something we didn't expect to be doing. Hang in there, okay?
All right, I will.
All right.
Bear Williamson from Sweet Home is one of the lucky ones. He was recently released from intensive care.
You remember this one, don't you, from the other day?
We caught up with him inside the VA hospital COVID ward while Dr. Shona Hunsaker and her team focused on his lung function.
Big breath in.
I think if he had not been in a hospital, he would not be with us today.
I was hurting.
Yeah?
I was a hurting unit.
This Army vet says the experience has been a tough lesson.
I didn't take it as serious. In fact, I kind of laughed at it, to tell you the truth. I called it the corn dog virus. And it's no joke. But yeah, I didn't take it serious at all. But I do now.
Now let me get through a cap, okay?
This pandemic erupted last March, like most wars, in a fog of confusion and fear.
It started out as a whirlwind of patients without a lot of understanding of disease, and that was really hard as a group of healthcare professionals to have sick people in front of you and not be quite sure how to diagnose them.
The first step was to create a COVID ward, a place to isolate contagious patients from the rest of the hospital. Temporary walls were installed, along with negative pressure rooms, which are constantly tested to help keep staff members safe.
What that means is when the door opens, the air sucks in. So for a respiratory virus, you don't want the air blowing out, you want it blowing in.
So this one I'm just using an N95 mask as a barrier and a shield.
Personal protection protocols that couldn't have been imagined just 1 year ago are now commonplace. Even so, outbreaks among staff have happened and remain a threat. Death has become a daily fact of life here. What do you say to these patients when they're in here all alone, no family, and they're facing death?
We have a no patient dies alone policy or practice, if you will, at this hospital, and so we absolutely make sure that somebody is there so that nobody is alone. Our nursing staff are absolutely incredible.
You guys doing okay back here? You have everything you need?
Yeah. Teresa Shepard and her staff of nurses do everything they can to ease the loneliness and suffering, but nothing in this new COVID world is easy.
Even the PPE that we wear creates a barrier to that. We don't get to see their faces anymore. They can't see our faces. They even really can't see our eyes because it's behind eyeglasses and a face shield, a gown, gloves. There's just none of that human-to-human contact that we're used to as nurses in giving our patients. And that's hard for nurses too.
All right, I'm gonna take a quick listen to you, okay?
Even so, these COVID warriors push through, drawing on strength from each other. And what would you say to the people out there who continue to believe that this situation is not as bad as they're hearing about?
My response would be that this is absolutely real. I've been living this every day for the last 10 months. This disease is real. It's somewhat indiscriminate. I've cared for 37-year-olds sick enough to be in the ICU. I've cared for 93-year-old World War II veterans who have been sick enough to be in the hospital, and everything in between. And it has not gotten that much better.
This life and death struggle has been going on behind these doors for 10 months now. And still, even after the vaccine rollout, we really don't know when this is going to end. Vaccines may be a game changer. Most of the staff is now vaccinated, and older vets like Paul Layer are doing their part to fight the enemy.
I think everybody should get it so we can get this COVID over with.
I'm tired of it. I've been fighting it for a year now. We've been at it for almost a year.
1, 2, 3.
If everybody gets the vaccination, maybe we can get that number down there where it's supposed to be.
Dr. Hunsaker couldn't agree more.
This is how we get out of this pandemic.
Positive signs, but with the new contagious variants of this virus now spreading in Oregon and across the U.S., the race to reach herd immunity and end this war is far from over. When you started dealing with this 10 months ago, could you have imagined that 10 months later, you'd be in the same situation?
No, because we feel like, we're all in this together. We don't know when it's going to end. It ebbs and it flows, and you think, oh, things are quiet now, and then the next week, we have a full unit again.
Great. How about one more?
Bear hopes to be released soon, but tells us he'll never again make light of COVID-19.
It's definitely an eye-opener. It'll get your attention. Like I said, you think it's a joke, but it's not a joke.
And that no joke comment there, that's something we heard over and over from the patients who nearly died from this virus. Again, we want to thank the VA for agreeing to let us be a fly on the wall inside that COVID ward where they're doing such great work.
Yeah, and we appreciate you sharing their story, what they're going through. So many men and women who served our country now fighting for their lives. You mentioned also that the staff there already getting vaccinated. So when you look at a hospital, does that mean that protocols ease up in any way, though?
No, they don't at all, really. While those vaccinations do protect the staff from serious illness, they can still carry the virus and spread it to their loved ones at home, and that means the staff must follow those strict protection protocols, not only at work, but they also have to do it at home, which really adds to the emotional toll on the workers and their families.
Wayne, we know how difficult it is to get into a hospital with all the privacy laws and then having this very, very contagious virus. What an eye-opening look and into that whole situation. We really appreciate it. You and Bill Cortez, great job.